My experience with Dr. Reynolds was absolutely amazing from the time I called till the time I finished my treatment with him.
He listened to all my crazy questions and answered all of them, which is great.
Dr. Reynolds just seemed to fit really well with my husband and I. We liked his style, we liked his knowledge, we loved his price. And so we trusted Dr. Reynolds.
When you walk into his office, you're not just a patient. You're definitely family. Everybody knows you by name. When you call the office, they know your voice. So you are definitely not coming to a doctor's office. You're coming home.
Hi, I'm Dr. Reynolds. For those of you considering a breast augmentation, I'm going to review some of the basics behind what we're trying to achieve and how we're going to go about it as plastic surgeons. Obviously, there's two main goals we have when we're doing a breast augmentation. Number one, increasing the breast to a size that the patient's satisfied with. Number two, either maintaining or improving the shape of the breast. And number three, doing this safely. Some of the biggest decisions we make when we're doing a breast augmentation are the following: where we place the incision on the breast, where the implant is going to be placed in regards to the breast tissue, as well as what type of implant to use. There's a lot of different implants on the market now, and there's benefits to each one, and we really want to make sure we choose the right one for you and that you're informed so that you can take part in this decision. I'm going to walk you down to another part of my office and we're going to go over these in more detail, and I'll have some diagrams and you'll be able to see some breast implants. Here's our basic implants. The main difference between all of these is this is saline, which is just salt water, and these are all silicone. I'll talk about the differences in the silicone. Saline is obviously, because it's a water, it's very fluid. It can ripple a little bit more. It doesn't hold its shape when it's upright on the chest. It's the least expensive to purchase. It's a little firmer on its end point. These silicone ones, the main thing that differs in these are the cohesivity of the gel. It goes from the least cohesive to the most cohesive. Cohesive meaning how much it wants to stick together. So for example, when we look at the natural gel implant or the classic gel implant, which has been on the market since 2007, you can see when it's upright, it holds its shape better than the saline does, but you still have some rippling and loss of volume at the top of the implant. Next we have the in between. This is gummy bear or still a cohesive gel, so if it gets cut in half, it doesn't leak, it just cracks. You can see when it's upright, it holds its shape a little bit better. Nice volume on the upper portion, a little bit of rippling, not too bad. When you squeeze it, it's a little firmer than the classic gel, but still relatively soft. They call this the soft touch. This is our highly cohesive gel, so it's the most cohesive gel in this line. You can see it really holds that upper pole fullness. So if you're trying to maintain shape on the top part of the breast, this does an excellent job doing it. It ripples the least out of all of these, but it is the firmest to the touch. This is an anatomic or shaped implant. It's made out of that same cohesive gel that we see in this highly cohesive round one, so that when it's upside down, it's still maintaining that shape. This gives a very natural look to the breast. It's covered in a textured coating in order to help reduce the risk of this turning inside the body. So as we see here, this is an example of a highly cohesive implant that's been cut. As mentioned, it's much like a gummy bear. So if you think about when you cut a gummy bear, it's a solid gel. It's not going to spill anywhere. The classic gel is more like silly putty gel. If the implant gets cut and it's squeezed under pressure, it's going to leak out. It's going to mainly stick together. But these new ones are pretty much going to crack. It's a solid gel. So when we're making an incision for a breast implant, there's a couple different sites we can use. The most common are the inframammary, so underneath the fold of the breast or around the areola. If we're doing saline or a very small silicone implant, you can also do it through the armpit. We call it an axillary incision. All of these incisions can be very discreet. The inframammary fold incision is a very direct approach. It hides underneath the fold of the breast. The periareolar, obviously it hides under almost all clothing, and outside of clothing it's right at that transition from areola to skin, and it hides fairly well. When we're determining the size of your implant, the number one thing we are thinking about as surgeons, or should be thinking about, is the base width of the breast, or some people call this the footprint of the breast, which is essentially just the width of the diameter of the breast. When we're deciding the size of an implant, I'll usually take you back to our clinic room. We get some sizers, put them in a bra, have you look in a mirror, and decide what size looks best for you. Once you've determined what volume you want to be, we mix that information with your base width or footprint of the breast, and that will help us come up with what profile of an implant to use on you. For instance, if you have a very small, narrow implant, it's not going to fill out that full footprint of the breast, and you'll get a little bump, either middle or lateral side of the breast. Or if you do too big and wide of an implant, it can make your breast look abnormally wide. You'll bump into it when you're walking. Ultimately, you want that implant to be within a pretty narrow range of what your breast width is. Sometimes we want to try to make that base width wider if you have a very narrow breast. So this is something we can change on purpose, but it should be a thoughtful decision we're making. The other thing we determine is whether or not to put it above or below the muscle. We commonly put it below the muscle because it gives the more natural look. It gives more padding to the breast. We put it underneath the pectoralis major muscle, which is right underneath the breast tissue. You can see an example here from a side profile view. Here's our breast tissue. Here's the pectoralis major muscle. So if you put an implant, you can put it on top of this muscle. It's not maintaining that fullness at the top part. It's sort of forming a nice natural shape. Will give a natural look to the breast. The transition is going to be a little more sudden. Sometimes it can be very apparent on thin people. Other times on people with more breast tissue or heavier, it'll mask those edges of the implant. If we put it underneath the muscle, it adds that additional padding here and compresses the upper pull of this breast to give a more natural sloped appearance to the breast. Now, if you want to have that upper fullness, but you don't want a really sharp transition, you can use some of the more cohesive gels. Here's an example of the Soft Touch Cohesive Gel. As you can see, if you compare this picture to the last one, this hollowing or gradual slope becomes a little more pronounced with a little more fullness with a soft touch because it's a more cohesive gel that wants to maintain its shape. If you want to get the most fullness you can on that upper portion of your breast, if you use a highly cohesive gel, you'll see it really maintains that dome or full portion to the upper portion of the breast. Well, I hope that was helpful for you. Come on down, meet the staff, and we'll take the time to make sure we pick out the implant that works best for you.